Right, once again, we are going to have this presentation about utero-vesical fistula. It is always a challenge to a variety of mothers. They are predisposed to various fistulas, and among them we have this utero-vesical fistula. We are going to see or to be guided by the following objectives. Number one being how does normal uterus look like, more so on ultrasound. Then number two, what is the meaning of the word fistula? And lastly, what is the sonographic appearance of utero-vesical fistula? Okay, so first of all, before we even look at fistula, let us first know the anatomical relations of the uterus. So the uterus is a pear-shaped female reproductive organ, which is exactly this one which I'm pointing at. It has several roles, but mainly it is a site where the baby grows or the fetus where it implants during pregnancy. And it is still an organ whose part called the endometrium does menstruation. So this is the uterus. Posteriorly to the uterus we have the rectum. There is a space between the rectum and the uterus, which is called the porch of Douglas or the recto-uterine pouch. Then anteriorly to the uterus lies the urinary bladder. Still, there is a space called the vesico-uterine pouch between the uterus and the urinary bladder. On the superior aspect of the uterus, always we find there the bowels, mainly small intestines. And then at the upper lateral ends of the uterus, we find there the fallopian tubes and the ovaries, not excluding the broad ligament. Then inferior to the uterus, it is continuous with the vaginal canal, which opens exteriorly. The other parts are just external. This is the pubis, this is the perineum here, and these are the rabies. Yes, I'm not going in the details of anatomy. So, still on ultrasound, when you are in the sagittal and you are pressing your probe inferior to the umbilical stump, then this is the image of the uterus, which you get using the urinary bladder as your acoustic window. So this is the uterus, which is continuous to the vaginal canal. So you can see how this anterior border is smooth, and again at its fundus, then its posterior wall, and then finally this inferior aspect. So sonographic anatomy of the uterus, it has basically three main layers. That is the perimetrium as the outermost layer. Then it is followed by the myometrium. That is when you're coming from outside going inside. So perimetrium, myometrium, and then the endometrium, which is the innermost layer. Then grossly again can be viewed as having the fundus, which is the superiormost part, then the body, which is the mid part, and finally the cervix. Okay, so after having that, still we can see This image was got using a transvaginal approach. So it is of the uterus. We can see the myometrium and the endometrium clearly. Okay, so after now getting what normal uterus and how it looks like, then at this moment we can try to understand what the word fistula means. So using this drawing, a tubular structure, always let's assume this is our tubular structure, which runs in this way. We can assume this is our esophagus. And now this is another structure. Let's say this is the trachea. So either way, they shouldn't, or each one should appear as a separate tubular structure. But if it happens, and now abnormally you find a connection connecting the structure A to structure B, then what we shall say they have formed a fistula. So this point here, I can say that this is a fistula at this point. This one is the fistula, connecting structure A and structure B. So in this case, if this connection happens from the urinary bladder to the uterus, then we shall say that the two organs have formed what we call a fistula. And that's what we are going to see how it appears on ultrasound. Okay, so this being my image, I was saying this one being the uterus, and then this is the urinary bladder. Hope you can appreciate this image. Alright, so on ultrasound, what you find, hope you were following. So this, we know that the urinary bladder always has an aqueous fluid, which is urine, and so it borders the uterus on its anterior aspect. So in this case, you can see this continuing line, this continuing anechoic line through the anterior wall of the uterus connecting to the endometrium. And in a transverse image, you will see this endometrium having this anechoic fluid collection in its cavity. And so this is what we call Utero-vesical fistula connecting. So it is the abnormal connection between the uterus, endometrial cavity, and the urinary bladder. Alright, so after getting this, hopefully you will not again miss it on ultrasound. We all know that among the predisposing factors, always we have things like previous scar, these mothers who are operated. So it can gap up and finally form this fistula. There are other various predisposing factors. That one you can read and you find it out. Okay. So finally, I thank you all for watching this video. As usual, I say like and subscribe to my YouTube channel for more anatomical and radiological videos. Alright, thank you.